What is artificial intelligence? I'm not an engineer, but this is what artificial intelligence. Artificial intelligence is simulation of human intelligence processes by machines, especially computer systems, encompassing learning, reasoning, and self-correction. This is all it does. So machine will behave like human. Okay, that's why it's called as artificial intelligence. It's the simulation which happens for learning, for reasoning, and it will ask for feedback. Whenever you work on a chat GPT or something, it asks for feedback, and that will help in self-action. So an AI system is a machine-based system that can, for a given set of human-defined objectives, make predictions, recommendations, or decisions influencing real or virtual environments. AI systems are designed to operate with varying levels of autonomy. This is in briefly about artificial intelligence. Now, it's very interesting when I went through the timeline of artificial intelligence. So these things started in 1950s itself, okay? And people started thinking, can machine think like humans? I think we also have seen a lot of fantasy movies where machine thinks like humans. But the time is there now, have come where the machine can actually think like. Then in 1956, John McCarthy first time introduced the word artificial intelligence. Then Joseph, he created a chatbot which can hold conversations with the human. Then we had a chess playing computer, Deep Blue, which defeats chess champion Gary Kasparov. Then next, Sony launched a first robo pet dog called as Aibo, whose personality and skills were developed over time. Then the first mass-produced robotic vacuum cleaner, Roomba, which learns to navigate in homes without anybody's command. Now, I think even in India, we find a lot of automatic vacuum cleaners. Then in 2011, Apple integrates iPhone with our very famous Siri, intelligent virtual assistant. Then came the question answering computer, which is Watson, which wins first prize in a TV show, Jeopardy. Then after that, Amazon launches Alexa in 2014, which is also a virtual assistant tool. And in 2020, first time GPT-3 tool was released for the conversation. But it came to the public domain only in 2022. And from 2023, we all started using it rampantly. There are certain eras in advance in the technology. I would say the first one was the mobile phone, where everybody could have mobile at around 2080. Then came internet. I think people call it as Geo revolution, where every mobile had internet. That caused another revolution. And I believe this artificial intelligence, after the introduction of ChatGPT and availability for public, this is causing another revolution in the field of knowledge. Now, I want to emphasize a little bit on ChatGPT because that is a common tool which we all use. And 6 months ago, ChatGPT released another thing called as GPT-4, which is an advanced version for which you have to pay $20 per month, which is around 1,600 rupees per month. What is the difference between the regular free ChatGPT and this GPT-4? Obviously, this GPT-4 has a lot more parameters and its computational power is enormous and it can handle complex, diverse tasks. Then it has a longer memory, like whatever you check will come in the side that you can see for months together, which you can't in the GPT-4 is slower and it has a certain number of prompts only per hour because it processes so much of data as compared to ChatGPT. Then it is capable of accepting visual inputs, like there is an option where you can upload your PDF, where you can upload your image, upload your documents and ask GPT to answer your questions. That facility is not there. Okay, and it is truly multilingual and it can handle multiple languages. So this is an introduction to ChatGPT. Now, before going into that, I just want to introduce ChatGPT for the people who have not used. I know many of you have been using. So this is how, if you just type ChatGPT, OpenAI, this will open. You have to sign in through your Google. All the apps which I'll be showing today, I'm already signed in. But those who will be using for the first time, it will ask you the sign-in procedure. You will have to sign in. So it will ask you so many things. So you can ask any questions. It is going to answer. I have subscribed for GPT-4. So when I press this side, I will have this. Okay, so can you see this upload button, attachment? So with this, I can even attach documents, which you will be seeing later how I can attach an Excel and ask GP to analyze. Okay, then there will be a sidebar, okay, where you have all these things. Okay, so there is one feature in this chat GPT-4 which is called as Explore GPT, which is a wonderful feature. Like you can customize. For example, you are a president of IMA of Tamil Nadu and you want to create programs. You can say, I am the president of IMA of Tamil Nadu branch, and these are my vision. Can you help me in planning and organizing? So once you devise a GPT of what you want, it will, you have to just type your problem. It will behave like you are the president of IMA and it will start giving answers. I had created one for my son. He is very bad in language, especially writing. So I said, I am 9-year-old boy who have problem in reading and writing Kannada. So you can you help? So it will give me suggestions. It will give me links where I can go and teach my son how to improve his language. So you can customize. This I'm saying for the general purpose. Other than that, people have customized it like for systematic review. Can you see here? Systematic review, expert review. If you want to, like, you get a reference in some other format. I was finding it very difficult. I thought this is the best way. I have created one where I just put any reference and I ask it to convert into Vancouver format. It will convert into Vancouver format. So like that, a lot of customized GPTs are available, and this is for the paid version only. I just wanted you all to introduce to the power of GPT before directly showing how the GPT works. So now coming to what are the applications of AI in health risk. I'm sure there may be a lot more than that. So the first thing is risk assessment, which we all do. What is the risk of cancer? What is the risk of getting something? So what these AI will do, it will analyze a large data sets and it will come up with predictions. We used to do it like whatever score we have, diabetic prediction score or our JNC cardiovascular disease prediction score, WHO heart disease prediction score, all these things which we did like manually. Now if we just feed data, it can give you the risk of a particular disease by it. Then of course for drug discovery, it is very useful. It can identify the potential drug candidates by analyzing its chemical compositions and predicting their effectiveness. Diagnosis and patient engagement, there are many hospitals like in Karnataka, Narayana Hridayalaya, it uses. So there is an AI called Medha. So when we go, we have to interact with the Medha. We have to tell what are the issues we have, and Medha will refer us to which section of the hospital we have to go. It will ask which department or which doctor we want consultation. So all these things, and if we tell our symptoms, it can also help in finding the diagnosis or probable diagnosis. What are the tests? And if you upload the test results, it will help in giving you the recommendations for the test results or interpretation of the test results and personalized recommendations. Rather than just giving one recommendation, it can give you tailor-made recommendation based on your own symptoms and signs and your own whims and fans. Then it is used for natural language processing, where it assists in analyzing large amount of medical literature to give summary and recommendation for further analysis. So these are few applications. I'm sure there are a lot more. In Karnataka also, in a medical college in Chitradurga, there is a whole cell which is working in artificial intelligence. They have created an AI tool where just by scanning the finger, it can tell the hemoglobin level. Then if you take a photo of X-ray of the chest X-ray, can tell what is the risk or is there tuberculosis or not. I'm sure a lot is happening in other parts of India also, but these are few things which I'm aware which is happening with help of AI. And India is not left behind. India started something called as India AI in the year 2020 itself, where a web portal is launched for all AI developments in India. India also conducted a global symposium where many people, including children, you can see it even in the YouTube, where they have presented their inventions using AI. And India recently released 75 at 75, India's AI journey, which is a compendium volume containing 75 AI use cases, which is implemented across India academia and also in corporates and startups.